For a long time, we have realized that doctors who work in hospitals or in other places of work, they also have health issues which they need to be addressed. We have had doctors when they lose patients, as much as they are kind of consoling the relatives of the person who has died, or they are consoling the friends or the parents of the person who has died, they have nobody to console with them. They have nobody to take them through debriefing for that loss. And when they go back home, they are kind of stressed and undergoing a lot of challenges. We also have doctors who have serious issues with substance abuse, work-related stresses, depression. We have doctors who have pricked themselves while in theater, and they have kind of been infected with HIV/AIDS. Others have taken ARVs while they are trying to prevent the infection from the pricking in theater. We have doctors who have challenges in coping with the stress in the working environment. So all these issues have really come up, and even when we have done the CBA, where we have agreed that the ministry and the counties will come with a program on how they will equip the facilities and have lunch rooms and have special units within the facilities where doctors can access healthcare themselves while in the line of duty. So today is a roundtable discussion with the many stakeholders ranging from ILO, that's International Labour Organization, UNAIDS, USAID, COTU, Minister of Health, the PS was here in the morning, the Minister of Labour, and indeed many other stakeholders who have come together today to look at how, number one, we can be able to identify the key challenges facing the doctors and indeed all healthcare workers in the work facilities. And then number two, come up with strategies on how we can continuously address these challenges so that the doctors and healthcare workers can provide their services when they are sober and when their issues are being taken care of. So after this, I think we'll have to come up with a secretariat moving forward, which then will look at the outcome of today's meeting and then initiate mechanisms of rolling out the programs in all our health facilities, especially in the counties. So as a union, we plan to have what they call a doctors support network in each and every county, where we shall have a team of 5 also doctors who will be able to identify from time to time doctors who are undergoing stress, doctors who are facing challenges at workplace, and refer them to appropriate institutions, attach them to professional counselors where need be. When doctors break themselves, they need to access healthcare immediately, whether it is at night or during the day. So access to PEP, post-exposure prophylaxis medications in the facilities, how they can be accessed, testing centers in facilities for doctors, and also special rooms or facilities within the hospitals where when doctors have problems, they can go confidentially and seek help from the providers. Also, we seek the government to give a lot of support for this program because we need facilities to be provided in those hospitals. So we need a lot of support from the side of government, both at national level and at the county level, in equipping and building capacity for those facilities. Also, as a union, we plan to conduct trainings for our members, that is the doctors of the union, on various aspects of occupational safety and health at workplaces. These trainings we conduct per county. Then the people we train will go ahead to train others in the hospitals and other workplaces. And this way, once we do a pilot project for doctors, then we plan to roll it out to all other healthcare workers as a whole program for healthcare workers in this country, so that at the end of the day, the healthcare workers themselves are safe enough to provide safety to the patients.